me and lunch is only 10 minutes. It is a privilege for me to be at this first International Radiology Conference organized by the Ministry of Health and Population. And this is the main point, first International Radiology Conference, but also look who's organizing, the Ministry of Health. I'm here to talk about the role of the International Atomic Energy Agency. And I will basically focus on what we do to promote and strengthen the practice of nuclear medicine and radiology. So before starting, just allow me to briefly mention what the IAEA is. I know that many of you are familiar with the IAEA, but many of you are not familiar. So the IAEA is an independent international intergovernmental organization and is part of the United Nations system. We work with our member states. At present, we have 175 member states and multiple partners worldwide to promote the peaceful, safe, and secure uses of all types of atomic energy and ionizing radiation. Our mission is to accelerate and to enlarge the contribution of atomic energy to peace, to health, and this is why I'm here today, and to prosperity throughout the world. And in doing so, we have three main pillars or areas of cooperation. One is the safeguards, very popular. This is why they call us the watchdog. That is basically to try to ensure that the member states are using the facilities and applications only for peaceful purposes. Then we have safety and security, extremely important. Professor Frosch and Professor Frilla just mentioned the relevance of using the technology in the right way. And this is what we do in the agency. We provide safety standards for the uses of ionizing radiation. Then we have the nuclear sciences and applications, which is the different phase of the IAEA. What we do is we support in the context of social and economic goals in the planning and use of nuclear science and technology for different purposes, including generation of electricity, very important nowadays, but also all the applications in human health. For the human health, we have an entire division working in supporting the countries to address their health needs through the use of what we call radiation medicine. That includes radiation oncology, radiology, nuclear medicine, medical physics, and some of the applications of stable isotopes for nutrition. Two sections working for radiology and nuclear medicine. My section, which is the clinical component, we deal with providing support to strengthen or establish the practice of this medical specialty. But we do not work in silos. We work together. There are so many other sections and divisions working towards different factors that will improve the practice. The dosimetry and medical physics, they do the improvement in the radiation imaging, the quality, the dosimetry, and we also work with the colleagues from the nuclear safety and security. I think Ola Ollenberg I saw him around. So what we do, we can provide support in all phases or stages of implementation of these medical images, starting by the why, the rationalization, why is needed, why we need a new department, why we need a CT scanner, why we need to improve or establish artificial intelligence, the right departments that is adequate to the demographic and epidemiological needs. So we need data. We need data coming from you. How many cancer cases, how many cardiovascular diseases? We have this multidisciplinary approach. We have physicists, radiologists, radiographers, referring physicians. So we include the training of everybody. The appropriate use criteria, it was mentioned also by the previous speakers, absolutely essential. It's not enough to say, I have 5 CT scanners, how I'm using the scanners. Is that adequate? The adherence to safety and standard regulations, not only from the radiation safety point of view, but in the case of nuclear medicine, the international pharmacopoeia point of view. Patient-centered quality management is absolutely essential. So we have 3 main programs, one for radiology, diagnostic radiology, which is called the Quadrille, nuclear medicine Quantum, and radiotherapy Quattro. It goes from A to Z, all the flow of the patient inside the departments. So we can provide this support. And last but not least, we promote the clinical research. It is absolutely mandatory to produce new evidence of what we do. It's not enough to say radiology is needed. Why is needed? So To assess the training needs, we need to count on you. What do you have? What is available? What is not available? Based on that, we need to see what needs to be improved. So the message in here is we need to work together, member states, professional organizations, IAEA, to be able to further advance and consider all the stakeholders that are included in the practice. We don't have to preach the converted. I mean, we know radiologists, we know, but how about the patients? How about the referring physicians? How about the health authorities? How about the policymakers? So this is also part of our role. We know that cardiovascular disease or non-communicable diseases are the main cause of mortality worldwide. And that is why we always say, okay, we have so many deaths and so many globally due to cardiovascular, to cancer, is this enough? What does it mean? Do I need more equipment? Is this global? It's not the case. Look what happened in Africa. We are going from 73 to, I don't know what happened with these new characters in here. It seems like this is what, 50, 31, sorry, I don't know why the characters were changed. But what in here what is important is that non-communicable diseases is still the main cause of mortality in Africa. So the needs for medical equipment are different. This is what we have to consider. What happened during the COVID time? Look, in the US alone, COVID from 2020 to 2022 became the third cause of mortality in the US with the peaks. Globally, we have an excess of mortality of 14 million people in 1 year due to COVID. So are we prepared for these kind of things? It's not enough to say, yeah, I have a good radiology department. Is the department prepared for the needs? Also, global market, we always talk about radiology is flourishing, is blooming, is growing. Yeah, we are growing. The question is, are we growing in a way that is equitable? And this is not the case. If you see the statistics, you can notice that the average number of CT and MR scanners in the high-income countries is tenfold the one available in low and lower middle-income countries. So this is super important to say where the equipment, and it's not only that within the country. I do have these scanners, but does everybody have access to the scanner, to the study? This is not the case. In Africa, for instance, we know that 6 countries do not have CT scanners, 9 countries do not have MRI scanners. As for the SPECT, only 29 countries have SPECT scanners. Only 7 countries have PET scanners, and there are mainly always the same, South Africa and the North. But the rest, so this is where is our role as community to try to improve the access, not only the availability, but also the access. It was mentioned by Dr. Boris about the availability of well-qualified professionals. Look how heterogeneous is the access to well-qualified radiologists and nuclear medicine physicians. In Africa, for instance, again, South Africa, Morocco, Tunisia, Egypt, Libya, Algeria, and Kenya, they have the highest number of professionals in the case of nuclear medicine, and it's exactly the same for radiology. It's 1/10 more or less of the radiologists that are available. So what are our initiatives? We have websites with educational materials that are absolutely freely available and accessible. We have the quality management programs. We have a full training program that is a distance training with 3 years of training for nuclear medicine technologies. We have databases to collect data coming from you in order to be able to advise. We organize webinars, we provide publications with guidelines, always working with the international community, with the professionals. We organize TC research projects, and this TC I will explain now. And international conferences. The next is coming in December. The question is why another conference? There are so many, ISR, ESR, RSNA, Egyptian. Because in this kind of conferences, we strongly promote the participation of professionals from low and middle income countries. And we provide grants for them to be able to go to Vienna and to present their work, which is extremely important to them. TC is the technical cooperation, is the bilateral way of communicating with the countries. So if there is a specific request coming through the official channel to the agency, we can even provide equipment. Just some numbers, 51 million euros procured in 2020 in radiology and nuclear medicine equipment for member states. We have, at present, some national and regional projects, and this is only the projects that we have in Africa. In my section, we are conducting 147 bilateral projects supporting the strengthening of radiology and nuclear medicine. It was mentioned by Dr. Frija, the Lancet Oncology Commission. These kind of publications are absolutely essential because, as I mentioned before, we know, we are convinced, but the health authorities in some cases are not. So they need to have elements to be able to communicate, to make the case of why radiology is important. So in this Oncology Commission that I strongly recommend you to take a look of, is the first time that the international radiology community came together, all the professional organizations, the IAEA, the WHO, to put the radiology in the view, let's say, of the health policymakers. It was mentioned by Professor Frija. It's not only that we managed for the first time to prove that if we scale up in the appropriate way and safe way and quality, we will be able to avert more or less 2.5 million deaths by 2030. And if we add therapy, it will be 9.6 million deaths, but also the return of investment that was mentioned by Professor Frija. Based on that, we put a series of recommendations that I'm not going to go through due to the time, but you can visit. We have some flagship initiatives. This is one of the most important initiatives for our new Director General, Mr. Rafael Grossi, that is to expand to access to radiation medicine to member states. The main emphasis is Africa, and the main focus is radiation therapy plus medical imaging and radiology as an enabler for radiation imaging. Just to mention some of the initiatives that we have. I'm going to go through this. There is another very important initiative that compiles what it was mentioned, the importance of having artificial intelligence, machine learning, which is called the ZODIAC, the Zoonotic Disease Integrated Action Project, which has 5 pillars, but I would like to focus on this one. It's data and nuclear application for human health. And what we are doing here is basically going through radiomics and artificial intelligence to be able to set up a process that could be easily deployed in a near future. There are some very important initiatives like the RSNA initiatives to have this repository of images, but this includes not only the images, but the analysis and the adoption and adaptation of artificial intelligence. So our view, our mission is to improve the clinical practice of radiology and nuclear medicine and the quality of the services that are provided. We have over 50 years of experience doing capacity building, education and training, providing support in the specific case of Africa, and in the case of nuclear medicine, 28 of the 54 African countries have received support for the establishment of the first nuclear medicine department, but the need is still huge. We need to continue working towards solving this. So our goal is to make radiology and nuclear medicine available, accessible, appropriate, and affordable. And I thank you very much for your attention.